You've probably heard kidney disease called a silent killer, right? Well, that's not exactly the whole story. The truth is, the warning signs are there, but they're super easy to miss or just blame on something else. So today, we're going to learn how to actually listen to what your body might be trying to tell you before it's too late. So here's our game plan. First, we're going to figure out why this disease is so sneaky. Then, we'll dive into 12 key signs, breaking them down into clues you might notice in the bathroom, full body warnings, and some other physical hints. And finally, we'll pull all it together and talk about what to do next. And this is really the big question, isn't it? I mean, we're about to go through a dozen different symptoms, yet for so many people, kidney disease isn't caught until it's really serious. How is that possible? And this quote just hits the nail on the head. The signs aren't silent at all. They're just easy to brush off. You feel tired, a little off, and you blame it on work, or stress, or not getting enough sleep. Life. These symptoms can be explained away so easily that we just don't give them a second thought. And that's exactly why being aware of them is so important. Okay, let's start with our first stop. Some of the earliest clues that your kidneys might be in trouble often show up, you guessed it, in the bathroom. Which makes perfect sense, right? This is ground zero for your kidney's main job, filtering everything out. So we're going to zoom in on 4 specific things here. Just a change in your normal routine, any kind of pain, the really obvious sign of blood, and something you might never think to look for, foamy urine.
The very first sign is all about a change from what's normal for you. Are you suddenly having to go all the time, or maybe way less than usual? Is the color a lot darker? Or worse, you feel that intense urge to go, but then nothing happens. The real key here is any big, lasting shift in your habits. That's a signal.
Next up, any kind of pain or difficulty. This could feel like pressure or even a sharp burning pain when you try to go. Now, a lot of the time, this is just a sign of a urinary tract infection, UTI. And while UTIs are usually easy to treat, you absolutely want to catch them early. Because if you don't, that infection can actually travel up to your kidneys and turn into a much bigger problem. All right, listen up, because this one is a big one. It's non-negotiable. If you see blood in your urine, you do not wait. You do not ignore it. It is one of the most direct signs your body can give you that something is wrong. This is not a wait-and-see symptom. This is a call your doctor right now symptom, period. And the last sign in this category is a little more subtle, foamy or bubbly urine. Now, I'm not talking about a few bubbles that go away instantly. I mean foam that sticks around, the kind you might have to flush twice to get rid of. Your bladder and your kidneys are a team, they're tightly connected, so what's happening in one is often a reflection of the health of the other. Okay, so let's zoom out a bit. When your kidneys aren't doing their job right, it doesn't just affect your urinary system, it's like a rock thrown into a pond. The problem creates a ripple effect that spreads through your entire body, leading to these full body or systemic warnings. And here's where it gets tricky, because these next 4 signs can feel really vague, which is exactly why they get dismissed so often. We're talking about being incredibly tired, feeling dizzy, always being cold, and getting short of breath. Let's dig into why this happens. So, how does this actually work? Well, it's basically a chain reaction. Healthy kidneys make a really important hormone. This hormone tells your body to make red blood cells. Red blood cells are like tiny little delivery trucks for oxygen. So, when your kidneys start to fail, they make less of that hormone, which means you get fewer red blood cells, which means less oxygen gets to your muscles and brain. And the result? That deep, unshakable fatigue. And that same lack of oxygen, it's the culprit behind our next symptom too. When your brain isn't getting the fuel it needs to run properly, you can feel dizzy, foggy, and find it almost impossible to concentrate. It's not you. It's a physical sign that something's off. Now, this one can be a little confusing. That condition we were just talking about, the drop in red blood cells, is called anemia. And a classic symptom of anemia is feeling cold all the time, even when you're in a warm room. But to make things more complicated, if the kidney problem is an actual infection, you could get the total opposite reaction, a fever and chills. Feeling short of breath can happen for 2 major reasons here. First, there's that anemia again, starving your body of oxygen and making you feel winded just from walking across a room. Second, and this is more serious, failing kidneys can't get rid of extra fluid, and that fluid can actually back up and start to build up in your lungs.
All right, we're on the home stretch now. Let's move into our final category of symptoms. These are distinct, often visible, physical clues that something is seriously wrong on the inside. And once again, they are super easy to misinterpret. we're going to cover 4 last signs here: swelling, weird skin issues, a very specific kind of bad breath, and nausea that just won't quit. Think of your kidneys as your body's expert drainage system. When that system gets clogged and can't remove extra fluid, that fluid has to go somewhere. It starts to build up in your tissues, which is a condition called edema. You might notice this as puffiness in your face, swollen feet and ankles, or even a tight feeling in your hands.
You might get a rash and just think, oh, it's allergies or I have dry skin. But when your kidneys fail, they can't filter waste out of your blood. So all those toxins just keep circulating through your body. That buildup can cause this intense, maddening itchiness and rashes that no amount of lotion is going to fix.
This next one is pretty wild. So when the kidneys fail, a waste product called urea builds up in your blood. Then some of that urea gets broken down into ammonia by your own saliva. This creates a very distinct, unpleasant, kind of urine-like bad breath. It's a clear as day signal of a serious internal chemical imbalance.
And finally, there's nausea and vomiting that just lingers. This isn't like you ate some bad food and you're sick for a day. This is a constant feeling of being on the verge of getting sick. It's basically your body's last-ditch attempt to literally throw out the toxins that your kidneys aren't able to filter anymore.
Phew. Okay, we have just covered a ton of information, 12 different signs, from your bathroom to your breath. So now for the most important part. What do you actually do with all this? What's the takeaway? This slide right here, this is the whole point. On the left, you see the possible cause. Yes, these symptoms could be kidney disease, but they could also be a simple UTI or anemia from something else, or just allergies. The goal of this explainer is not for you to self-diagnose. The goal is on the right, the certain action. Any of these signs, if they stick around, is your body's way of screaming at you to go see a doctor and get a real diagnosis. That's the only move.
And really, that's what it all comes down to. These symptoms aren't silent. They're signals. They're messages. They are your body trying its best to tell you that something needs your attention. The only real question left is, are you listening?